I'm delighted to be here. My name is Tal Gross. I'm a professor at the School of Business across the street. So I want to tell you about a paper I wrote with Tim Layton and Daniel Prince that I think can teach us something about cost sharing, about co-payments and deductibles, about whether all of us should pay something whenever we consume medical care. And there's a growing share of Americans who face deductibles, who face co-payments. Deductibles and co-payments used to be relatively rare, and they're becoming more and more common. Over half of Americans are on some sort of deductible. Are these a good idea or a bad idea? Well, Olafsson and Pagel have a paper from 2018 showing, this is outside of healthcare, that low-income households in Iceland spend 70% more on days when they get their paychecks than on the average day. And this is a finding that's been replicated throughout household finance, throughout the subfield of economics that studies how people manage their finances, which is that people they wait until they have cash on hand before they buy stuff. You go to the supermarket when your paycheck arrives. If you're going to buy a television, you wait until your paycheck arrives. And this is surprising to economists because most people, maybe not the lowest income people, but most people have access to ways of transferring money over time. And yet we see that people tend to be liquidity sensitive when it comes to consumption. They wait until their cash is on hand before they buy stuff. What my co-authors and I wanted to do is study whether this applies to healthcare, because healthcare is a little different than buying a television at Best Buy or other forms of consumption. Healthcare is time sensitive. And if people are waiting until they get their paychecks, then that could be an issue. So we studied when Social Security checks are distributed. And they're distributed based on this schedule, which is, here's this month. And of the millions of Americans on Social Security, if your birthday is between the 1st and the 10th of the month, then you get your Social Security check on the second Wednesday of the month. If your birthday is on other days, then you get your Social Security check on a different Wednesday. And what that allows us to do then is compare someone who just got his Social Security check to someone who's going to get hers in 2 weeks. And that's our natural experiment. That allows us to make that comparison and see how having cash on hand changes your healthcare consumption. So we find a big effect. Here's a graph of prescription refills for people on Medicare. And what we find is that for people who face co-payments at the pharmacy, there's a 10% increase in prescription refills when Social Security checks go out. For people who don't face co-payments because they're on a special subsidized plan under Medicare Part D, but they still get Social Security checks, we see no effect. So this suggests that people are holding on until their Social Security checks arrive before they get their meds. And we separated this by all sorts of different types of healthcare consumption. So low-cost drugs, high-cost drugs, refills, or your first script for a given prescription, chronic drugs, acute drugs. And then we asked physicians, what are some drugs we should look at, particular types of drugs that are really time-sensitive. And for almost every category, we found a big effect that there's a spike in prescription refills when people's Social Security checks go out. Now, this is concentrated in the low-income population. The horizontal axis here is a noisy proxy for how much money someone has. It's your median household income in the zip code where you live. And so the effects are much larger in low-income zip codes than in high-income zip codes. But we found this pattern in practically all groups except for the highest income groups, which is that people wait until their paychecks arrive before they go out and pick up their meds. And we think that informs how we should think about co-payments and deductibles.